It's really a pleasure to be with you here again, and thank you so much for watching us in another edition of the Health Data Forum Global Talks. And today we have two special guests with us. It's Steve MacFeely and Ravi Shankar from the WHO. I will ask them in a minute to please introduce themselves, and asking them also if they can share something that would happen a little for a war story in their roles and capacities in WHO, or also from their life that would normally not disclose to the public, if they are so kind. Starting by alphabetical order, would be Steve, the first one, right?
Well, it depends if you're taking our first name or our second name.
I was taking, yes, the second name, of course.
Okay, so hello everybody. My name is Steve MacFeely. I'm the Director of Data and Analytics at the WHO based in Geneva. There's probably no war stories that I can share from work, but let me just tell you a bit about myself. I'm from Ireland. I worked in the National Statistical Office for many years. Then I joined the United Nations. And I worked with UNCTAD. I was chief statistician there, and then I joined WHO last year. And if I look back over my career, my life, probably the best decision I ever made was when I got married. I took a year off work, and we traveled around the world for a year, sailing and backpacking. And we just took a year out. Everybody said I was crazy. You know, you lose all this time at work, you lose all this experience. It's the best decision I ever made.
It's amazing, Steve. Thank you so much for the sharing. How about you, Ravi?
Thanks, Steve. That was a great intro. My name is Ravi Shankar. I work at the headquarters. I work for Steve MacFeely in the Department of Data and Analytics. And I lead the WHO GIS Center for Health. It's a recently established entity to support activities related to GIS for the within the organization and also with the member states. I'm from India, and I worked in polio eradication initiative at the global level before coming to this role. Like Steve had a story, maybe if I had to tell something, maybe I am very passionate in doing agriculture. So we bought a place in India, a farmland, and that's where I spend my Christmas time, 3 weeks in December. I spend there working and toiling the soil, and it's a very sustainable, eco-friendly a piece of land, which gives it's my Zen mode. When I want to turn to my Zen mode, I go there. Thank you.
Fantastic. Thank you so much for sharing this. And it's also a surprise, perhaps, or not for you. I'm going to show you a video with an excerpt from interventions of Dr. Samira Asma when she opened the Health Data Governance Summit organized by the WHO last year. And I'm wondering if you feel that they are still relevant. Let's watch the video now.
Excellencies, honorable delegates, colleagues, and friends. On behalf of Dr. Tedros, who unfortunately is not able to be with us today, I warmly welcome you to the second Health Data Governance Summit. The COVID-19 pandemic is a wake-up call for us all and has underscored the critical importance of data and science. We need to galvanize your support to take bold steps and make data a global public good. This cannot happen without common governance standards, solutions, and structures. 2.5 quintillion bytes of data is produced every day. Despite this dearth of data, we all struggle with data gaps and our inability to provide real-time solutions for real-time problems. What remains uncounted cannot be solved. With a focus on three main important areas: research data sharing of public health and disease surveillance, and the importance of legal and ethical considerations for data policies and practices. Persistent inequities, as has been exacerbated by the pandemic, and are preventing us from equitably achieving the Sustainable Development Goals and the triple billion targets. We must close these inequities and be prepared for future health crises by ensuring stable partnerships, trust in data, investments in countries' health information systems, and political commitment. Without these, we will be far way off in achieving the Sustainable Development Goals. WHO is committed to embracing partnerships, and I would like to close with what Dr. Tedros often says: we cannot make progress unless we can measure progress.
Okay, so how about this? 1 year has passed and we listened to these motivating comments. Are they still relevant today? And perhaps starting with you, Steve, and then Ravi.
Yeah, thanks, Paul. They are. I think almost everything Samira says in her statement is still applicable today. And let me pick out a few points. One is it's still the aspiration of WHO, and this is what we're working towards, is ensuring that all of our data and all of our data products are global public goods. So whether it's just normal statistics or whether it's GIS maps, GIS service, the idea is to make these freely available to everybody at the same time. She also emphasized data governance, and this is critical, especially in the health sector. A lot of the data that we're dealing with, whether it's individual records, genomic data, or even if it's geospatial data that pinpoints a location, this is all sensitive information and it must be treated with the utmost of respect. So data governance is absolutely critical. And then I think the third point she made, or the third point I'd like to just mention now, is inequality. I would add a dimension to what she said. I mean, we're working to try and reduce inequalities, whether it's access to vaccines, or access to medicine, access to just universal health coverage, but also within the data world, we see a growing concentration of data holdings. So not only access to good healthcare, but there's also access to data. And that brings me back to the public good. This is why we're fighting so hard to make sure that our data are global public goods, to make sure that everybody has access to the information that they need to inform their decisions.
That's really interesting, Steve, because I think this message is so important, and it's also for us a pleasure to have you on board this event and amplify this message by your participation. But Ravi, how about you? Not sure, you were not yet in the WHO when this event happened last year, but what is your feeling about the relevance of these statements from Dr. Samira, Asma?
I think Steve covered it very well. I think it's very much relevant. Just to add only one point is we are talking about equitable distribution of vaccines, right? That's where GIS also plays a big role in that. Like our DG at one point said that if there are 16 vaccines reaching the Western world, one vaccine reaches Africa. But then the question comes, even this one vaccine, where does it go within the country? Does it go to the affluent people or to? That's why the GIS as a tool to have these measure of this equitable distribution of vaccines can be very, very powerful to know the status at every point.
Mm-hmm.
Thanks.
That's awesome. And now turning a little bit the page and going on to the this year theme for our Health Data Forum Global Hybrid Summit in Porto. We're talking about health data quality, and this question will go for Steve. What's your stake in health data quality, Steve, and why is it so important?
Okay, let me take the questions in reverse order. Let me explain why it's important. So oftentimes when we're dealing with people, I often hear the statement that some data are better than no data. And I disagree, because it depends on the data. If we accept the premise that we want this information, we want these data and these statistics to inform decisions, then if the quality of those statistics is poor, then is all they're going to do is misinform us, and then we end up making a bad decision because of bad data. So data quality is absolutely crucial. Now, there's several dimensions to quality. So let me just mention one of them, which is timeliness. So you can have the best quality information, but if it comes out 5 years after the event, then maybe it's not that, it may not be useful. It may be perfect data, but it's not, there's nothing you can do with it anymore. So there's a trade-off between speed and precision, and we're trying to find a balance between those two. Now, that doesn't mean you have to have information instantaneously. You often hear a lot of talk about real-time data. In a lot of cases, we don't actually need real-time data. What we need is data that's timely and appropriate to the use that we're using it for. So we want to produce data in a timely fashion. We want to produce good quality information. So that will help to inform decisions and help to keep governments and keep even the WHO, everybody accountable regarding the decisions they make. So what's the WHO's stake in it, or what's my stake? Well, I'm the director for data and analytics. So what I want to ensure is two things. One is to ensure that the data that WHO produces is of the best quality that we can possibly make it. And then secondly, to work with countries to ensure that the data that they produce, either to give to us or to use for their own national purposes, is as good a quality as they can make it, and it's suitable for their purposes.
Fantastic. Thank you so much. And I'm so pleased that we're going to have a strong representation by the WHO this year in Porto. So the two of you are coming. And I know that there's also an innovative aspect in the work that you're doing concerning health data. Ravi, can you expand on that? What's the innovation that we can expect to hear from you this year?
Thanks. I think the innovation is a continuous process, right? Whatever we do, we want it to be innovative in the way we want to do it. I just want to mention, we took this example of the COVAX equitable distribution of vaccines, but it's also applicable for various other things. One example I could say is a snake bite. So there's a project jointly done with a neglected tropical disease, where they asked simple questions like, there are 7 to 10 countries in Africa, and the phase 1 of the project, they wanted to know what are the right locations to put their anti-venom stockpiles. So it's a simple question like that. I have very limited number of anti-venom stockpiles. What are the right locations to put that? So it's a simple GIS question, but this is where we're trying to use the innovation to do that. We exactly need to know where people live, and what are the facilities which have the capabilities to host these antivenoms, because it also needs cold chain, it has to need the electricity and also the capacity of the facility colleagues to handle that. And then you need to have some sort of a drive time analysis, so that you can see within certain amount of time you should be able to reach to the nearest facility when you're bitten by a venomous snake. This is one part of the equation, but the other part of the equation is also to know where are these venomous snake. So it means there's an innovation there to map the habitation of these venomous snake. There we are using the crowdsource, where people are contributing photos of venomous snake, which is geocoded. So we are taking that and improving the habitation layer of the venomous snake. It'll be very surprising to say that what I heard from our colleagues from NTD is some of these habitation area comes from museum records. So it means that it could be very old and it could be very approximate. But if you want to do a precision analysis, you need to have a better level of quality of data there. That's where the innovation of crowdsourcing and crowd is coming into that, where people are geotagging and putting the venomous snake photos, the location. We are taking that and sharpening the habitation area. Then we are overlaying each one of these layers in terms of the roads, in terms of the facilities, in terms of where people live. And also we are finding out vulnerable areas. So it means some of the snakes are always found in the agricultural lands where their harvesting is going on. So we are adding those layers and building this and coming out with a good solution. And one other component of innovation there is also to do machine learning and AI to identify where people are living. So we are building this year. We are building a tool to do automated feature extraction from the satellite imagery, which could be accessible for everybody. So it will be an online open source tool. People could directly use it like they could use a Google Maps or Google Earth. Thank you.
Fantastic, really. So I think there's so many reasons for you to be joining us in Porto Faculty of Medicine next November. And last question to close this global talk, and this is for both, of course. If you had a magic wand in your hand, what will be your desire in relation to health data? Stephen, and over to Ravi.
I only have one wish, right?
Right.
I think, improving data is a slow process. So I think more than good data itself, I think what I would wish for is two parts of the same thing. One is a more realistic appreciation of the importance of data, and also a more realistic appreciation of the uses and expectations around data. So a lot of times what I have to deal with is unrealistic expectations, and people who think once they have data that they can solve all of their problems, or that they can do all sorts of projections or forecasts. And oftentimes the data aren't good enough to support it. Equally, I see people who want the data, but they're not willing to do the investment into the foundational pieces, so around the data architecture. So I think maybe you could call it data literacy. I think maybe better data statistical literacy. If we had that, it wouldn't improve the data, but it would be an important step towards improving the data, both the quality of the data and then the uses to which it's put.
Fantastic. So health literacy as a magic, as a wish. How about you, Ravi?
I think if I have a magic wand, we have a huge volume of COVID data, case-based data, like millions, like 300, 400 million records are there, right? If there is a magic wand, I would like to geocode all these individual cases, so that you can imagine the potential of researchers and for the development of the science, how well you could do spatial analysis with the data. I think it could also be a missed opportunity, but it's also a lesson that we should, as they say, catch them at the source, so that when the data is collected, you have a right address coding for where the patient is, or where he's getting admitted, where he's getting treated. These sort of geospatial information could be very, very powerful.
Fantastic. Wow, that was an amazing show today. Thankful so much for your presence here, Steve and Ravi. And I know that you travel so much, and inclusively Steve was taking a day off to be with us. That's amazing. And hopefully we'll see each other soon in Porto in November. And dear viewers, you have still some time to register, and of course you can also join us remotely, because we want to be as much inclusive event as possible. Thank you so much, Steve and Ravi, and stay tuned for next episodes of the Global Talks until our summit in November.
Thanks, Paul.
Goodbye for now.
Thanks.